Ataque de nervios in Latino culture. Ataque de nervios, also translated as attack of nerves, is an intense but brief release of emotion thought to be caused by family conflict or anger. Like all fear responses, ataque de nervios may present differently in different individuals. In general, however, most cases show similar signs and symptoms. It may include uncontrollable screaming and crying, intense fear, inability to move, verbal attacks and aggression, chest tightness, heart palpitation, fainting or seizure, and heat rising from chest to head. Panic attack shares very similar symptoms, but the two disorders should not be confused. Ataque de nervios occurs mostly in women. Women over the age of 45 are at higher risk, but men can develop it too. Additionally, stressful life events and exposure to violence are consistently associated with a wide array of negative consequences in psychiatric disorders. Other risk factors are associated with childhood distress and impairment. Recent evidence suggests that although a portion of those diagnosed with ataque de nervios also meet criteria for panic disorder, the majority of subjects with ataque de nervios do not, which suggests that ataque de nervios is a unique construct. Key features that distinguish ataque de nervios from panic disorders include a more rapid onset of attack, being preceded by an upsetting event in one's life, and a greater fears of losing control, going crazy, depersonalization, sweating, and/or dizziness. Puerto Rican syndrome is often treated as a panic disorder or another anxiety disorder, like the use of cognitive behavioral therapy. Those who are prone to the condition may have a tendency to suppress anger and other negative emotions, which then come out inappropriately during an attack. Clients learn to recognize and stop their triggering thoughts, as well as use of coping skills to work through an attack. Lastly, a therapist must carefully examine the client's history, cultural background, or current life circumstances to develop a full understanding of these issues.
The link between ataque de nervios and somatic conditions in adults has already been established in previous studies. This article examines the relationship between ataque de nervios and somatic complaints in children, specifically those ages 5 to 13 in both Puerto Rico and the South Bronx, New York. In both locations, ataque de nervios was associated with the presence of some somatic complaints like headaches, stomach aches, seizures, and asthma. Symptoms differed between children in Puerto Rico versus the Bronx. Children in Puerto Rico were more likely to suffer from serious illness or injury and headaches compared to their peers who did not have ataque de nervios, whereas children in the Bronx were more likely to have asthma, headaches, and stomach aches than compared to their peers. In the Bronx, children who suffered from ataque de nervios were 3 times more likely to have asthma and 2.5 times more likely to have headaches and/or migraines. The article compares the context of children's peer relationships in those that are victims to Hurricane George and those diagnosed with ataque de nervios. Researchers used girls and boys ranging from the ages 11 to 18 who lived in Puerto Rico 12 to 27 months after Hurricane George. Children exposed to hurricanes and peer violence are both predictors to the development of ataque de nervios. Researchers found that hurricane exposure was a strong predictor in the development of ataque de nervios. Social support and peer violence did not have an effect on development. However, Those with violent peers are more likely to experience Ataque whether exposed to a hurricane or not. Thank you for watching this presentation on Ataque de nervios.